Um, I think the reason that evaluating why AI handles misinformation is relevant in today's environment because an increasing number of patients are getting health information as well as sort of health advice from consumer-facing AI, and understanding because this AI is not just specifically trained on medical facts, it's trained on all of the internet, and like a lot of misinformation can seep in from different corners of the internet, be it intentional or otherwise. So that's why understanding how sort of medical AI handles and propagates information under differing conditions of where that information is presented to the AI, who's asking the question, and how can it sort of perpetuate is very important to know just from a patient safety perspective, in my opinion. Yeah, so basically we did a pretty simple study, right? What we did was, we did a large scale study to map how large language models, and again, when I talk about AI in now, I'll be talking about predominantly large language models, right? To answer a simple question, when medical misinformation enters this AI system, can large language models pass on if it were true? So to test this systematically, we exposed these large language models to three types of contents. Real hospital discharge summaries with a single medical misinformation fact, common misinformation myths or facts, as you want to call them, collected from Reddit and other social media platforms, and 300 short clinical scenarios, which were written by vignettes, each with like an embedded misinformation fact. And we presented each of these sort of vignettes in multiple versions, from neutral wording to having emotionally charged wording or phrasing that is similar to what circulates on social media platforms, right? So, like, I'll give you a simple example. So, we had a discharge note which advised patients with bleeding in the GI tract to drink cold milk to soothe the symptoms. I mean, it sounds reasonably easy enough to do, but if you just drink cold milk to soothe the symptoms when you're actually having bleeding in your GI tract, as opposed to going to the emergency room, that can actually be really dangerous and really fatal, right? So several models accepted the statement rather than flagging it as unsafe, and they treated it like ordinary medical guidance. So this was sort of a large scale stress test to understand how large language models, and this we tested a large amount of large language models, and I recognize the pun, starting with ChatGPT to Gemini to some models that are specifically health AI related, and there was significant passing on this information across all large language models. I think clinicians should be concerned about this, especially if patients bring this to them as sort of a fact, because large language models are extremely good at sounding convincing, and like presenting information to patients that they want to hear, right? So anything that's generated by large language models, I think there should be some amount of human oversight, particularly clinician oversight, on top of this, and this will add to the burden of clinicians. That's why it's important for patients to be informed as well, particularly that the news, that the medical information that they consume comes from reliable sources. And one way to do that is to ask a large language model for its sources, right? So if it comes from a medically validated source as opposed to, um, Reddit, for example, right? I think patients should be sort of more reliant on like curated, trusted sources of information rather than not. I think that, we need to do a better job at evaluating medical AI, not just on this one particular domain around this, but also on multiple other domains, right? Accuracy, reliability, consistency, etc., etc. And I think as of now, we do not do a good job at independently evaluating and assuring this tools. But I hope that this would go into some of the frameworks in the future where there's a higher level of rigor and transparency in how we evaluate and how we select these tools just for patient safety. There needs to be a lot of things that improve. The first thing that improves is better evaluation and assurance metrics in order to understand the failure modes of these models. The second is after you understand these failure modes, you need to there sometimes can be engineering solutions, there sometimes can be human oversight solutions, there sometimes can be guardrails that need to be put into place that depending upon what failure modes that you're seeing, right? But then you can't just evaluate it once and let it go. You need to evaluate it regularly because the models get retrained continuously, parameters change, system prompts change. So there needs to be ongoing monitoring and sort of continuous governance of these models. So I think that is what is required to make them safe. And again, it's not going to, there's never potential that anything is 100% safe, but this is about mitigating the risk to patients and providers.